It's certainly great to welcome you back to Get Connected. I'm your host, Conn Jackson. It's now time for Health Beat. And there's this, we've all heard of hepatitis C, not even sure how one gets it, but it is a health concern, and we'll be talking about it today with a world-renowned doctor as well as Denise. And Denise, I know you got some good news to share, but you had a big scare. Tell us about your diagnosis.
No, more than a scare. Yeah, I delivered a baby about 30 years ago. And during that delivery, I had a blood transfusion. I went to go get some life insurance after that, just to find out that I was denied. They said, go talk to your doctor. So I went and I talked to my doctor, and he told me that I had Hep C. That was not good news. But I went and I got treated back in 2005. I did it in 2007. It took 48 weeks, both treatments. Nasty treatments, unsuccessful treatments. Time passed. I kind of lived in a cave. I had mush brain. Wasn't a whole bunch of fun to be around. But I was told, go talk to the doctor again. There's new treatments. I did. I went. I took new treatments, a pill a day, and I'm cured. I never thought I never thought that I was going to be able to say that I am cured of hepatitis C. It used to be a potential, life sentence, and it's not that way anymore.
Well, that is certainly great news to hear that there is a cure and that you're doing great. But doctor, I hear about hepatitis. I know it's not good, but I don't even know how we get it.
So about 3 million people are infected with hepatitis C in this country. And what's amazing, that 75% of people who have hepatitis C don't know they have the infection. So the critical question, what people need to know, is that 85% of people with hepatitis C in this country are born between the ages of 1945 and 1965. So if you're in that age group, you should go and get tested. Talk to your doctor. It's a simple blood test that can tell you whether you have hepatitis C. Unfortunately, most people with hepatitis C have no symptoms, and sometimes it presents too late. And sometimes they can go on to develop significant scarring in the liver, liver failure, and liver cancer. So the important thing is, go and see your doctor. If you're born between 1945 and 1965, ask to be tested. And once you're tested and you find out you have hepatitis C, as Denise has said, there are treatments available. We have a new treatment now. You can take a single pill once a day, and you have over 90% chance of being cured within 2 to 3 months with minimal side effects.
And doctor, what health concerns does one have if they have hepatitis C, don't know that they have it? What does it do to the body?
So what it does, this virus attacks the liver, and then by attacking the liver, it causes scarring in the liver. And as that scarring builds up, you can go on to develop liver failure and potentially liver failure. And what's amazing about this infection is that once you're cured, any damage to the liver is potentially reversible, especially if you're treated early. And that's why it's so important to get testing done as early as possible. And today is National Hepatitis Testing Day, so it's even more important to go and see your doctor and get tested, simple blood test.
Well, doctor, thank you for that information. It's important that we all are aware, and Denise for being an advocate and bringing us good news about the cure. Doctor, any last words?
The most important step that you can take is to go and get tested. Speak to your doctor and get tested, especially if you're born between 1945 and 65. And then go and again see a specialist to get treated as Denise did. There is a cure, and that cure can be as simple as taking 1 pill a day, and you will have over 90% chance of being cured. So don't wait, go and get tested. Start today.
Well, one thing's for sure, the message is clear. Thank you both for being with us today.
Thank you.
Thank you.
Take care.